Thank you for joining us for this edition of FormWeb in a Minute. I'm Laura Paxton, President of FormWeb. Today we're going to explore how one of our clients uses FormWeb to communicate their USP 800 program regarding handling and disposing of hazardous medications. The health system that we're going to look at is Legacy Health System, a 7-hospital system in the Portland, Oregon area. Let's look at their site. On the left side of the screen, you see that Legacy has used several of their sub-formulary listings to delineate their hazardous high, hazardous medium, hazardous low, and RCRA lists. We're first going to look at the hazardous high list. So what we see here are all the medications in the Legacy formulary that are considered to be hazardous high. Let's just click on one of those drugs. And what we see here are the brands, generics, forms, and strengths that are available in their formulary. You see that they've also put policy information there, a high alert policy, link to their high alert policy. But today we're going to focus on looking at their hazardous high chemo, personal protective equipment, and disposal instructions. We're going to click on that. It'll open in a new window. And we see the administration information for the Legacy hazardous drugs list. You see that this is a high-risk hazardous D drug. You see that they have a definition of that title, and then they have specific notes. This particular document is something that they link to under each one of their hazardous high medications. And then we get into this area where they show the personal protective equipment that's required for high-risk hazardous D. As you look at this information, you see that what they've done is they've used the NIOSH information, and they have made it very easy for a nurse, a pharmacist, a physician to understand. We see that they also have specific instructions for the disposal of those medications, and they tell you what bin they go in. And another thing that they've added on their list are their patient education notes for when patients have to take this medication home. And then they embed the actual link to their policy that sits on their hospital's intranet into this document. As we look at the Legacy site, you see that here is the list of their medications that are considered to be hazardous medium. Here are the medications that are in their formulary that are considered to be hazardous low, and then here's the RCRA list. Just for comparison's sake, let's look at the hazardous disposal information on a RCRA medication. So you see they give you examples, personal protective equipment, and what bin does that go into. Once again, they've got a link to their policy embedded in that document. So that is a great example of the way Legacy actually communicates a lot of that information. One of the things that Legacy also does particularly well is they make sure that they put all of this information that you saw on those drug monograph pages in their FormWeb at the point of care, so the clinicians can find that information very easily. So they use the EPIC system at Legacy. So what we're looking at right here is a standard order entry view for warfarin at Legacy. And you see in their reference link area, they have a link to their Micromedics drug points, and they have a link to their Form website there. So let's just hit the next button, and let's see what happens. So we see the FormWeb. Someone clicked on FormWeb, and we see the warfarin monograph in FormWeb come up. And it's easy for the clinician to get to the information they need. On this particular warfarin monograph, you see the brands, generics, forms, and strengths that are available. You see a table that's been created that gives the top common side effects, and then patient education materials, dosing, reversal, and then we have the hazardous information as well. You also have links to all the subscription drug information. The important thing to remember as you look at this is Legacy has decided what are the important pieces of information that a clinician needs at the point of care, and they embed that information in FormWeb so that that clinician has the information they need where they need it, when they need it, and it makes their job and their workflow so much easier. So thank you all very much for listening to this edition of FormWeb in a Minute. I'm Laura Paxton, and we look forward to our next edition of FormWeb in a Minute. Thank you.